What's wrong with healthcare, from my perspective, is that it is a totally unmanaged process.
It is a structure that's focused on repair, not avoidance.
Healthcare in this country costs twice as much as any other developed country.
The current payment system pays more for doing more, and more often than not does not pay more for doing a better job.
We clearly have a crisis when it comes to our healthcare premiums.
Over 100,000 people in this country die from medical errors each year.
If you don't have health insurance in this country, there's a 25% greater chance that you're going to die.
We have about 60 million people that don't have health insurance.
It's a cottage industry that's now turned into the dominant economic expense for our economy, and yet it's not designed as a process. It's designed as an episode piled on top of an episode, piled on top of an episode. And that then results in what we have, which is excessive expense, excessive risk, and quite frankly, mediocre outcome.
The problem is big. It's very big. And I believe after talking about it for years, we're at the breaking point.
First, I think we need to not kid ourselves. It's not going to be easy.
I think the elevation of the discussion about health reform has really created a more dramatic need for better leaders.
To me, at the end of the day, it comes down to a collaboration around a shared vision with strong leadership.
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 One of the first to see the depth and complexity of these issues was Dr. Dan Hanley, a family doctor from Brunswick who became known in Maine and across the nation for his leadership. He was a pioneer in using data and research to improve care. He helped establish the Federal Agency on Health Research and Quality. He developed the U.S. Olympic drug testing program, and he never lost sight of his commitment to making a difference, one person at a time.
He just was a person who had a lot of common sense and really was able to focus on addressing problems or doing something that would make a difference.
And we really liked the idea of building on his legacy and trying to promote the values that he promoted throughout his life that made him successful.
Today, the legacy and the leadership that Dr. Hanley demonstrated is being carried on by the Hanley Center for Health Leadership, with strong involvement by Dan's family.
The Hanley Center is doing the right thing at the right time by bringing people together to collaboratively work on issues.
Leadership development is all about drive and vision and but it is rare to hear that term collaboration.
Our overall mission at the Hanley Center is over time to create a greater culture of collaboration.
The Hanley Center's role as a convener and as an educator for those individuals that want to have an impact on healthcare is critical.
We have to be able to step beyond the more concrete, tangible kinds of things that we're used to paying for. We have to be able to invest in vision and leadership and courage and all those kinds of attributes that Dr. Hanley embodied so well.
The problems are huge. It's the biggest domestic issue of our time.
It's going to take courage from all of us to change. It's a lot easier not to change.
If the Hanley Center weren't doing it, somebody else would have to do it because it's absolutely essential.
We have the right people. We now need to give them the support, the tools that they need in order to make a difference.